The Parrot Club is very pleased to have Dr. Kristin Sinclair here tonight. Those of you in Connecticut know that Dr. Sinclair is one of our board certified avian vets here at Kensington Bird and Animal Hospital. I provide her bio so you can read that, but she's been with us a number of years now, has given us a number of fabulous talks, and we've asked her to talk about living with the disabled and geriatric and chronically ill bird with us tonight, a subject that a lot of us have had to deal with. So without any further introduction, Dr. Sinclair.
All right. Well, thanks for coming out tonight, everybody. So this is a chat we had a couple years ago, but I've updated it a bit for you. So hopefully there's something new and exciting. So with geriatrics, this in human world is the branch of medicine that pertains to elderly patients. As we age, there's a lot of changes that go on naturally with the body. These things such as minor problems that can become serious complications. Like if I get a cut on my knee, I will get a scab and I will be fine. If my grandfather gets a cut, he's on blood thinners, he might bleed more, or it might take him longer to heal. If I get exposed to the influenza virus, I'm more likely to have a crappy couple days and then I'm fine. My grandfather might end up in the hospital. I can eat spicy food and not die. He looks at a taco and he's done for the day. Sometimes symptoms can be more vague as we age. Is it because our joints hurt? Is it because we've got gout? Is it because we've got something else going on? And even things like drug metabolism will change with age. Our processing organs aren't quite as efficient as they used to be. So the same dose of aspirin that would make my knees feel better might be way too much for my grandfather. Part of what we need to do as a creature ages, whether you be human or bird, is to differentiate between what is truly a disease or an abnormal pathologic process versus just normal aging changes, and likewise not dismiss potential problems as normal aging changes. So in human medicine, this is a whole specialty branch. We don't really have that specialty branch in our pet care per se, but we certainly do deal with it pretty extensively. So with parrots, in parrots, we use them actually as a study model for aging in other species. As you've all probably noticed, your 10-year-old cockatiel and your 20-year-old cockatiel and your 5-year-old cockatiel often look very much like the same bird, whereas the same kind of age difference in a human, you'd notice the difference. So a lot of our wild populations of birds are used as study models to find out what is it about birds that they age so well? Why do they live so long and don't seem to show any aging changes? And to take from that, what do we learn from them that we can apply to humans so that we can age just as gracefully? So why is it birds live so long? I mean, our dogs don't get into their 50s and 60s. What is it about birds? Is it because they've got extra protection against oxidative cellular damage? We hear all about antioxidants when we read up on health websites and such. Is it because they have extra antioxidants? Does it come down to telomerases? The telomere is, if you can see in this little drawing of a chromosome here, that red spot in the end is the telomere. This is a bunch of redundant DNA at the end of our chromosomes. Basically, it's there to protect from damage. If you repeatedly divide a cell over and over, eventually those ends start to shear off, just basically almost like mechanical injury. The more telomere you have, or an ability to replace that end cap, it seems to be correlated with longer lifespans and less aging. Do they have more enzymes to replace them? Do they just have bigger telomeres? We're still learning about this. Are birds just more resistant to cellular injury that would lead to aging changes? There's also the question of how much of this is genetic versus environmental, and what other health factors play into aging and why some show it more than others. So, as far as parrots go, at what age is a bird considered geriatric? Well, that heavily depends on the species. Your 6-7-year-old budgie is definitely getting into their senior years, whereas a 6-7-year-old African gray is just getting started. So it's heavily dependent on what species we're working with. In terms of what we're going to talk about tonight, we're going to talk about what we can expect to see as our parrot ages, what do we expect, How is it going to compare to the human aging processes? And then again, are these truly age-related problems, or is this a sign of a problem we need to address? We're going to get into the common things we see going wrong with age, what we can do about them, and we'll wrap up with some end-of-life considerations, because unfortunately that too is a part of geriatrics. So, taking care of the ancient parrot. Ultimately, knowing your bird is the most important thing. You've lived with this bird for 5, 15, 30 years. You know this bird like the back of your hand, and you know what's wrong. You know what's different. So when you notice problems, just like any other issue, young or old, be proactive and intervene early. The sooner we can get a bead on this, the better our outcomes tend to be. Regular veterinary care is important. We at our hospital generally suggest 6 months exams. Some of our clients elect to do it just on a yearly basis or whenever there's a problem. But as the bird ages, it's definitely important to keep up with us with a relatively frequent examination schedule. Our goal is to catch the problems before they become massive quality of life issues or something we can't fix anymore. Often with the older birds, I do suggest blood work on a routine basis. Some folks do it every 6 months as long as there's no health problems. I personally am content with once a year. Some people elect to forego that, but it is an important thing to think about with your aging bird. Again, trying to catch problems before they become life altering. Husbandry is, as always, super important to taking care of these old fellas. Good diet, making sure their housing is appropriate, and making sure they've got their appropriate daytime, nighttime schedules. And this is something we'll dig into a bit more in our following slides. So with the aging birds, one thing you will notice is overall there's a decrease in fitness. The albatross is a great example of this. Older albatrosses, they tend to take longer foraging trips. This does not necessarily mean they're athletic and they can stay out there longer. It just means it takes them longer in order to collect enough food to keep themselves going. They're not as efficient a hunter as a younger albatross. With that comes lower daily weight gain. They're not eating as much, they're not as efficient at catching fish and such, so they don't gain as much weight as their counterparts. With that comes reduced reproductive success. There's not necessarily a menopause that they go through per se, but as you age, you just don't lay as many eggs as you used to. Your eggs aren't always fertile, and you tend to have that decrease in your reproductive success, as they call it. And this is thought to be due to just general physical deterioration. My wing joints hurt, so I'm not going to fly as efficiently. I'm going to crash into things. I can't dive quite as quickly at the fishes. Immune system function does also appear to be affected as we age. And this, like the example with my grandfather and I with the flu, his immune system isn't quite as efficient as mine, and mine is not as efficient as my niece's. A lot of this work has been done in barn swallows and flycatchers, and they have found that elder birds have lower antibody responses to various bacteria and viruses, meaning that their immune system isn't producing quite as exuberant a response to a potential infection. Does this actually impact their overall health? Antibody response is a nice way of measuring how the immune system works, but the numbers do not always specifically correlate to are you protected and how well are you protected. It may be that the elder barn swallow produces 25% less antibodies when confronted with salmonella, but it's still protective. Whereas, the same difference in the flycatcher may mean that that flycatcher gets horrible blowout diarrhea from salmonella. Where it comes into play for us bird owners is that we, as far as we can tell, there is some reduction in immune system function as the bird ages. So keeping that bird sequestered away from other birds is a very wise idea, just in case other birds are carrying infectious diseases that may be a problem for your little fella. Or at least keep them away from sick birds. Try not to mix and mingle with unknown birds. As far as medical considerations, in humans, we tend to see changes in mental state as we age. Even if it's not necessarily Alzheimer's, sometimes our parents get a little forgetful as they age. They don't quite remember details, life events. So far in birds, there's at least been no reported case, there's no case reports or studies on senility per se. Anecdotally, people will notice that the bird seems to forget where the cage door is, or forgets where the food bowl is, or seems to interact differently with people. They're more clingy, they're more standoffish, they don't want to hang out with their bird friends anymore, or they might get grumpy. They're just crabby all the time. Now, unfortunately, we can't really talk to them and see what's running through their brain at that point. So these kind of changes could just as easily be vision loss. I can't see the cage door anymore, so I am not going to go near it, or I'm going to bump into things, or I can't hear, so I don't know where the people are, or I don't understand what's going on. I'm painful, so of course I'm going to lash out and bite my friend when they want to hang out. Hearing loss is very common in aging people. To our knowledge, this does not seem to happen with birds. That said, can we ever guarantee they're truly listening to us as they, ignore us and chew on our favorite books? Feather loss, again, something we don't tend to see in human males, and sometimes in women, we will see things like baldness happen with age. We don't seem to see them going bald. However, we may notice some feather changes in terms of less preening. Tails, especially, it takes a lot of twisting and bending to reach around and groom your own tail, and that can be a painful process if you, say, have arthritis. You just can't reach your tail without pain to preen it, so they may need help with tail health. So, amongst the medical concerns I think we see very commonly would be musculoskeletal pain. Arthritis, certainly amongst the top ones, and we note this quite a bit. It's thought that the incidence may be similar to what humans see, where if we all live long enough, eventually we will have some arthritis, and it's thought that the birds are in the same boat. Interestingly, though, there's been an inverse correlation to body weight. You would think that the heavier birds, like your macaws and your big fat Amazons, would have more joint problems as they age because they're the big guys. Their joints are carrying more weight. But it actually tends to be the little guys that seem to have the most trouble with it. Your cockatiels and your conures, which makes no sense at all to me, but that is how Mother Nature built them, it seems. Common areas include the knees, the hocks, which basically is that little ankle joint there, and elbows and shoulders, all those really high motion, high impact joints. With the knees and hocks, this can lead to bumblefoot or pododermatitis. If we're bearing weight funny on our feet, eventually one of those feet is going to start to get extra beat up. It's going to wear more abnormally, and you'll see those red changes, the swelling, and other problems on those feet. Older birds are also more prone to gout, which is a consequence of kidney disease. Gout is the deposition of uric acid crystals into joints and on organs. Uric acid is a kidney waste product that's supposed to be removed from the bloodstream, and that's that white stuff you see in their poop. But if their kidneys are not functioning at 100%, they don't filter out all that waste product, and it forms little crystals that like getting stuck in small blood vessels, such as those in the joint. Those crystals, if you ever see one under the microscope, they are very, very spiky. They cause a lot of pain and inflammation by their mere presence. Osteoporosis is something that we can occasionally see as well. Diet plays a big role in it. Birds that are on seed diets for much of their life, they tend to be vitamin D and calcium deficient, which sets them up for weaker bones. And reproductive status, your female birds that are producing eggs through their whole life, they have a massive calcium draw, and sometimes that calcium draw over time will lead to some weaker bones as they age. And certainly weak bones, they break easy, and they are more painful in general. So what might you see with a bird with some orthopedic pain? They may have some difficulty perching well, or they may not be able to perch at all, especially birds with small perches. If you imagine, how much foot movement is involved in curling a foot around a small perch. A small perch, you've really got to grab on tight and hold, and that can be very uncomfortable if your joints are hurting. Big perches are easier to work with for those birds because they literally just have to slightly grab in order to hold on to that perch. So much less work, much less joint movement. Platforms likewise, and flat perches are also great for these guys because literally they just have to stand flat. No grabbing involved. So it's a stable place. They don't have to bend joints to sit there. It's easier for them to stay upright. We've probably all seen our bird friends using their beaks almost like a fifth appendage to move themselves around the cage. They'll use it to climb. They'll use it to hang off the top of the cage and swing like a goofball. So having opportunities in that cage for them to use that beak to compensate for aching joints will be very helpful. Narrowly spaced bars can be a big help. If they've got a big gap to cover with those beaks, it's harder for them to move around. If the bar spacing is a little closer, The beak is better able to move them around in place of a foot, and those little feet don't have to move too far to move up the cage. Textured perches likewise can be very helpful. The smooth wooden dowel perches don't really give you a lot of friction and grip, so it's easier to slip from those, whereas a natural branch perch has nubbies and branchings on it that give them extra things to hold on to and better grip. A rope perch is also very nice for this because it's got lots of nooks and crannies to hook a toe into, and it's nice and soft on the feet, which is pretty pleasant. With the birds with the most extreme immobility issues, low perches are definitely the way to go. That way they don't have to plan on hopping or flying up to a perch. They can literally just step up onto that perch, maybe step onto the next one, but it's easy to reach rather than a perch that's a foot off the ground. Because they have trouble perching, these are birds that will fall more often than typical. They can't hold on to the perch, or if they have to make adjustments in perch position, they have trouble making that quickly and they may fall right off the perch. So having a padded cage bottom will be a savior to them. That way they have a soft place to land when they make that fall. Towels work, fleece blankets work. I've had people use memory foam covered in a plastic garbage bag as well. Memory foam is super soft, very cushioning, and if you cover it in a plastic bag, you don't have to worry about bird poop all over it. You can just wipe off the plastic and you're golden. A limited number of perches is also a great idea. Some folks have this idea that if we can't really use those perches and we have trouble stepping from perch, maybe we just make a ladder or stairway system to where they can slowly make their way all the way up to the top of the cage. The problem is if that bird falls, it's just that many more things they could hit on the way down. So fewer perches and low perches are going to be your friend here. That way there's less for them to strike if they do fall. And if they do fall, it's only a couple inches to the bottom instead of a whole foot or two to the bottom of the cage. So because we are limited in our vertical space, we don't want those birds to get too high. Our focus is going to be on square footage. If we can't give them vertical space, give them horizontal space. That way they can walk all around, they can have interest in things to do, but they're not putting themselves at risk trying to climb a 5-foot cage. Easy access to food and water is likewise going to be important. The food bowls that hang on the side of the cage can be very difficult to access or perch at if your feet are hurting you or your knees are hurting you. So having a couple extra spare bowls just literally on the bottom of the cage makes it easy because they just have to walk on over, grab a pellet, and boom, we're good. We don't have to make that arduous climb up to a hanging bowl. Toys also have to be considered with a bird with orthopedic problems. We need not only safe toys, but the ability to actually use those toys. A dangling paper toy at the top of the cage means nothing to a bird that can only climb about a foot before losing their balance. String toys like some of those rope things that they like to shred or things with coconut fibers may not be a good idea because toes can get stuck in those. And this is a bird that already can't move their legs terribly well. Sometimes it means we have to give up our foot toys or limited foot toys because we literally just can't pick them up to enjoy them anymore. So things that can hang on the side of the cage where we can walk over and shred that and worry it, ding a bell, will be easier for us to play with and still keep us interested. Grooming, you wouldn't necessarily think of grooming as something to ponder with an orthopedically challenged bird, but it does have some importance. For example, toenails. Obviously, we don't want pointy toenails because they get stuck on everything. And likewise, no toenails that are too long because it's hard to grab a perch with crazy long toenails and you get caught on things. At the same time, you don't want those toenails too short because they still need something to hold onto that perch with. So if we cut them too short, they're suddenly left with absolutely nothing but creaky old toes to hold onto the perch. The decision of whether to clip wings at this point, it's very individual. It depends on each bird and their situation. The advantages to unclipped is that if the bird does fall from the perch, they've got a chance at catching themselves and breaking their fall before they hit the ground. On the other hand, it may encourage them to fly. And these are guys that don't use their feet or wings terribly well. If the bird is clipped, they're less likely to fly. And that means less risk of them crash landing if they do try to fly because their feet don't work. But if they do try to fly, that means they may be more prone to crashing. There's not really one right or wrong answer with wing clipping elderly birds. It's what works for your bird. With wings, I have found that a lot of times when I'm meeting an older bird from a client that just acquired the bird, like grandma died and now I have her Amazon, or hey, my friend got sick of this bird, now he's mine. I have to say, several times a year, I find orthopedic injuries that nobody knew about. There'll be an old wing fracture that has long since healed. They can't extend the wing, and nobody ever noticed. Um, so and also we'll see immobile joints. Wing joints develop arthritis just as much as any other wing. All those old injuries can lead to future problems with the joints because the wings aren't being used correctly. Now, with wing injuries, sometimes major changes in the housing are not really needed. Um, they've got perfectly functional legs, they just can't fly. Some of the changes are similar to what you would do for a bird with a leg injury, where maybe not too many toys around the perch because they can't catch themselves if they do take a tumble. Or maybe just we have lower perches, so they're not encouraged to fly so much. These are birds that cannot really fly from one location to the next, so we want a cage that's very navigable by feet and beak only. So these are birds where sometimes those stairways of perches can be helpful because they can kind of hop their way around without having to fly from place to place. These birds don't tend to thrive in aviaries because it's a large space, it's built for flying, so they have trouble accessing primo perches and food sources. They're basically living on the ground of the aviary. But these guys, typically, we don't have to worry about wing trims anymore because, well, they can't fly anyway, so we're really not accomplishing anything with that wing trim. The one situation where it could be advantageous is if the bird has a chronic wing droop where they can't hold the wing all the way up. Sometimes the wing droops so low that they're literally tripping over their own feathers, and those are birds that will benefit from a wing trim for their safety. So here I've got some examples of some modified caging with orthopedically challenged birds in mind. So on the top left here, this is a cage you will find in the small mammal section of the pet store. I have one for my rats. But the advantage here is that it's a lot of horizontal space, but not a lot of vertical space. So it's easier for the bird to get around. There's looks like some shredded paper bedding at the bottom, which is soft if you happen to land on it. You'll see all of those perches are no more than a couple inches off the ground. The food and water dishes on the bottom left are literally right there on the bottom. The other three photos are from a pair of budgies that used to live at the hospital. These guys had leg splays from the time that they were babies. Their legs, that one on the bottom left there, that's literally what his legs did all the time. They never really sat underneath them. So what those birds have is, you'll see their toys are hanging from the side, so they're easy to get to and play with. They can actually jump up and fly a little bit, but they really enjoyed that platform they're sitting on the top right photo. It's just a wire mesh platform, and they would just hang out all day. They'd hop down and drag themselves to their food bowls, but they seem to be pretty happy little budgies, even though they had their issues. They could still get around and they could still play with toys. The bottom right, you can see their food bowl and their water dish. It's flat. That particular food bowl you will find in the reptile section of the pet store. They intend for your lizards, mealworms to go in that thing. It holds parrot food just as well as it does bugs. Now, with our orthopedically challenged bird, there are other things that we can do to help them. For example, a good diet, as we mentioned earlier, is going to be super important. Number one, we want to prevent obesity. Big birds that have a lot of extra weight, that's a lot of extra strain on those poor arthritic joints. So keeping them fit and trim will reduce the workload and strain on those joints quite a bit. Likewise, we need to preserve their foot health as much as possible. Those feet are not going to be bearing weight quite as normally as they used to. Keeping them healthy, especially with vitamin A levels, is going to make for happy skin and happier feet. With vitamin A, that's going to be your pelleted foods. That's going to be your brightly colored vegetables such as carrots, sweet potatoes, orange and yellow bell peppers. Foods that focus on those orange and yellow spectrums tend to be very rich in vitamin A and carotenoids, which are your precursors in the diet for vitamin A. Pain control may be needed for these birds. On my end, we often use meloxicam quite a bit for these birds. Gabapentin. Tramadol is not quite as effective as we had thought it was, but some birds do respond to it. And there are other options that we do have, but some birds do best when they are kept on a regimen of pain management. Joint supplements potentially have their place as well. There's not tons of long-term studies on the joint supplements in birds, but we do have good old glucosamine and chondroitin that have been used in dogs and cats and humans for the longest time. An easy way of getting that into them, if you're familiar with the good old NutriBerry product, there's a senior NutriBerry that is geared towards the older birds. It's got the glucosamine and chondroitin built right into it. When you try to use a human product, you're basically using an emery board to flake off a couple corners.
I think you should take him for a walk.
So it's easy to use the NutriBerries
Because he's limping.
try to measure or flake off a tablet. Now, in dogs and cats and horses, there's a product called Adequan that is often used for arthritis and joint problems, and it provides them with the different building blocks for preserving joint health. This has been tried before in parrots. It did not end well. If anything, it had a lot of fatal reactions in parrots. So if you do bump into someone that suggests Adequan for your parrot, please run in the other direction. So other medical concerns that will come into play with our elderly parrots include vision loss. Just like with us, their vision is not as great when they age as when it was when they're young. In particular, we see a lot of cataracts in elderly birds, and it's one of the leading causes of blindness in birds. Now, this has to be differentiated from a situation called nuclear or lenticular sclerosis, which is a normal hardening of the lens as we age. With a cataract, it tends to be a full-on opaque white lens, whereas with sclerosis, it's kind of a hazy color, hazy change in the lens. They can still see through it. They pick up light and shadow and shapes, but it's just they're not reading the newspaper anymore. Retinal degeneration has not yet been reported in parrots, but it certainly happens to everyone else, so I don't see why it wouldn't happen with a bird. Atherosclerosis or heart disease is another potential issue that can cause blindness. We'll talk about atherosclerosis in a little bit more detail in a few slides, but basically the blockages in blood flow caused by plaques in the arteries, amongst other things, can impact the brain and vision. And then other things such as, brain tumors, glaucoma, and such occasionally will be found in our parrot friends. So basically we have 3 different types of vision strategies in birds. Let's get the pointer up here. So with type 1, which is more what our parrots tend to do, we have the birds whose eyes are mounted on the sides of their heads, but they're somewhat forward facing. So you've got this field of vision. The white areas are where you have monocular vision, meaning one eye covers that territory. The gray area is the overlap where you have binocular vision. The black area represents the blind spot where no eyeball can see. So with birds such as our songbirds and our parrots, we've got a pretty wide field of vision. There's a narrow area of precision vision right in front, and then a big old blind spot behind their head. With something like a duck, where the eyes are more mounted on the side of their head, a little higher up, but not quite as forward sitting, you've got a very narrow area of precision vision, but so much monocular vision all the way around their head, aside from this itty bitty little blind spot. With an owl, which is more like the setup we have, the eyes are in the front of the head, so you've got this wider area of precision binocular vision, a area of peripheral vision, and then this big old blind spot behind their head. Thankfully, these guys, as we all know, can rotate their heads a good 180 degrees, so that doesn't tend to hinder them much. So this is roughly about what you'd expect for the normal bird. If you develop a cataract in the left eye, basically this is what you're left with. You lose all of this area of your field of vision right here. That's about half of your vision. This area in gray basically becomes monocular vision. You don't have precision in front of your face. You just have basic, less detailed precision. If you imagine sneaking up from this bird from over here, he's not going to have any clue you're coming unless you make a lot of noise. So this can be very startling to them. So with the blind bird, we want to avoid major changes to the cage. In most cases, they have the layout of their cage, your house, if they are allowed loose time, they've got it memorized. They know, okay, I flap my wings 8 times and then I reach the kitchen table and I can perch there. I know that my food bowl is 8 steps down this perch and 1 step to the right. If we make sudden changes where, hey, I'm going to move your food bowl in this corner instead, they're going to be very confused because the food bowl is not where they remember it. Or if you get a new couch, suddenly they're going to accidentally slam into the couch because they didn't realize there was a couch there. Location of the cage likewise is important. If you decide to move them from the kitchen to the living room, they're going to be very confused when all of a sudden those comforting noises of cooking dinner are suddenly gone. They're thinking, oh God, where's my flock? I'm so confused, and it can be very upsetting and stressful. We want to announce our presence when approaching that bird. We do not want to startle them. So auditory cues are important. They rely on sound just as much as they do vision to navigate their world. So when you enter that room, talk to the bird. Hi, Polly, I'm here. Don't get afraid. Um, Try to approach from the side where they can see you. Don't be a ninja and sneak up on them in silence from their blind side. Because once they realize you're there, all of a sudden they're going to be startled, and that's going to lead to a bird that's going to fall off their perch. They may even fear bite you because, holy cow, you just scared the bejesus out of me. Cataract surgery can be an option for some birds. With that, in humans and dogs, what they do is they have technology to basically break up the cataract, leave the covering of your lens behind, and they'll stick in a fake lens so that you can see again. Now, for the most part with birds, we don't have fake lenses that are small enough, but they can at least get the cataract out. The vision that results is not perfect, but at least they can see shapes, light, dark, and enough to get around. Larger birds, usually not any of our parrot friends, do have the option of a fake lens. Pain management is important for some of these guys. As a cataract matures and develops, it can reach a stage called hypermature, where it has gone past that lovely gray opaque cataract to the point where the lens is literally falling apart, and that can cause a lot of inflammation. Those guys might need pain management. The worst case is where the lens is completely inflammatory and falling to pieces. Some of those birds may even need the eye removed. Not our favorite option, but it is our last ditch effort for comfort. Right, please. So here's some pictures of various birds with cataracts. Our little peach face here has a lovely gray cataract. Now, even if both eyes are affected, this is a bird that might be okay as long as we don't change too much in their environment. Or if it's just the one eye, he can be a perfectly happy lovebird with one eye. This falcon, on the other hand, these guys are visual hunters. So if with this cataract on his right eye, he just basically lost 50% of his ability to detect prey. And that could be a bird that doesn't feed itself so well because it literally can't see a rabbit on the right side of its body. A captive bird, say if he lived at a sanctuary, he'd probably be okay because someone is serving him. But as a wild bird, this could be crippling. This could lead to his doom. This is a picture of a bald eagle that was treated at the University of California vet school a couple years before I got there. This bird actually did have cataract surgery, and they did give him a fake lens. Now, this guy had other issues, so he was already a non-releasable eagle that lived at a local zoo. So even with his wing injuries, he was still having trouble getting around with the cataracts. So they did one eye to restore some of his vision and improve his quality of life for his remaining days at the zoo. Now, cardiovascular disease is something we are increasingly recognizing in our aging parrots, and atherosclerosis is the main one. This is the deposition of plaques within the arteries. We see it all the time in middle-aged humans. Your standard human that is most likely to develop those is the middle-aged man that is sedentary, eats a high-fat, high-sugar diet. They may be obese, but it is super common to see in middle-aged and older people. In humans, you expect the heart attack, clutching my chest, my arm goes numb, I can't breathe. In parrots, we don't tend to see that. The signs are much more vague, and they can be really all over the place. We do have some known risk factors, and a lot of it boils down to diet, the species, and in history of obesity. Amazons, by far and large, the entire Amazon genus is number one most likely to develop plaques in their arteries as they age, followed by the African greys, followed by the cockatiel. Now that said, we have diagnosed it in quite a few species. I have eclectuses, we've found it in budgies, we have found it in cockatoos, we have found it in macaws. Basically, there's really not a species where we haven't found it. Female birds, interestingly, are more commonly diagnosed. This is thought to stem from the fact that they're the egg layers. And when they are getting ready to lay eggs, they mobilize a lot of fat in the bloodstream to make those eggs, and that may set them up for trouble. Seed diets are a known risk factor. Basically, they're McDonald's of the bird diets, and If anyone in the human world is going to develop heart disease as they age, it's going to be the person that lives on cheeseburgers and French fries 5 days a week. The basics of what happens with heart disease in birds are very similar to humans, but there are some important differences. So this is a picture of a human artery. The one on the left here is the normal artery. So you've got your lining, you've got your muscle layer, and then here's the outer layer. And blood just comes shooting on through to the rest of the body. Over here on the right, we have an example of an artery that has those plaques. Basically, we've got this mess here of inflammatory cells, lipids, calcium molecules, and other debris that builds up under the lining. And as it builds up, it bulges into the opening of the blood vessel. And over time, this gets bigger and bigger and bigger. As it gets bigger, there's less and less space for blood to get through. And that is when trouble happens. So with humans, the common place you put those plaques is here in the coronary arteries. And these are the arteries that serve the heart muscle itself. In humans, you get enough of a blockage from those deposits, and suddenly part of your heart isn't getting blood flow anymore. And that's what causes a heart attack. This guy right here in humans is known as the widowmaker because these tend to be fatal heart attacks when this one gets obstructed. Now in birds, they put it mostly here in the aorta, which is the main blood vessel leaving the heart, and it brings blood to all the rest of your body. It goes up and around, actually goes behind the heart, and then I've drawn in its little continuation down here. Plaques building up here will stop blood flow from getting to anything downstream. So say you put them in up here, you're not going to get blood flow to maybe your head or your right wing or your left wing. If the plaques build up down here, blood flow is not going to get to your legs very effectively or your kidneys. Sometimes some birds will put it in the pulmonary vessels, which are the blood vessels that leave to go to the lungs. We have a bird in the hospital, Larry, a blue and gold macaw. This is where some of his lesions are. And the only reason we knew there was a problem with him is you catch him breathing heavy occasionally for no good reason. So in terms of what we can do, this is a really challenging disease to manage because the clinical signs can be vague. Sometimes it's breathing heavy. Sometimes I can't use a leg. Sometimes the Auburn eagle flies into a goalpost at a football game because he can't use his wing effectively. Sometimes the bird literally drops off the perch dead one day, and that's the only sign we get. Unfortunately, once the plaques are built up, there's not much we can do to get rid of them. A human would go to the catheter lab, they'd have a stent placed, they might have bypass surgery done. We just do not have that for parrots right now. The blood vessels involved, if something goes wrong, they're literally dead right there. A lot of it is right now prevention. And certainly we harp on that quite a bit at our hospital. We don't like dealing with this disease when it develops. We'd rather prevent it. So this is going to boil down to, just like with people, diet and exercise. Healthy diet, get plenty of exercise, try to manage those risk factors the best you can. Medications have been used to some degree of success. Isoxaprine is one of our workhorses. It helps to kind of relax the blood vessels and let blood get past those obstructions. It's not a perfect solution, but a lot of birds do find help. The statins have had a patchy history of helping birds. The statins have been investigated for atherosclerosis in birds. The troubles we're running into is that even at the highest doses we've tested, they don't seem to get any absorption. You can't detect it in the bloodstream once you've given them even some pretty high doses. So whether it actually does anything for them is questionable. The effects on their blood panels, we have investigated lipoprotein panels in birds, just like they have in humans with the high density lipoproteins, the low density lipoproteins. They don't seem to respond to the statins in birds quite as reliably as they do in humans. And many birds with heart disease don't even have any changes in their lipoprotein profile, Larry being an example of that. So the statins have kind of fallen out of favor for our bird friends. Supplements have had some questionable effect. Often we will suggest an omega-3 fatty acid for its anti-inflammatory effect, since often there are some inflammatory cells involved with these plaques. Now, they certainly don't get rid of the plaques, but the goal is we want to help prevent further inflammation and plaque development. My dear friend, nutritionist friend, has done a study with birds looking at which fatty acid supplements provide the best effect for birds. And she looked at various markers for immune system function and inflammation in birds. The one that had the best effect unfortunately, was fish oil, which of course every bird loves, nice and fishy. Flaxseed oil, unfortunately, didn't get quite as much effect as the fish oils. Many bird owners do rely on flaxseed because who wants to wrestle fish oil into their bird? But it's not quite as effective. We have found a brand of fish oils, the Barleen brand, that comes in an orange flavor. It's orange flavored fish taste, but our birds seem to accept it really well if we put it on a Nutriberry. So that's what we've been using for our hospital crew. Liver disease is another thing that we see fairly common. Often this is a consequence of a lifetime of issues such as poor nutrition. The seed diets, again, can set you up for some liver problems in the future. The liver has a lot of filtering and metabolic functions, so if you throw enough junk at it, it will be impacted eventually. It's really susceptible to infections. It's really susceptible to toxins. Malnutrition, again, can have a pretty heavy toll on it. And the signs that we see ultimately reflect the reduced function of the liver as the bird ages, as metabolism changes as we age, and also the consequence of a lifetime of punishing our poor liver. The signs we'll see, sometimes it's just a matter of overgrown or weirdly growing beaks. The beaks aren't getting the building blocks they need to make happy, healthy beaks from the liver. We may see weird toenails that fray or crumble easily or break easily. The feathers might be duller with dark black patches on them. We can see impaired protein and glucose metabolism. These birds may not be able to maintain a proper blood glucose. They may be lacking in certain blood proteins that are very important to function. The worst case is as the liver starts to fail, we'll see fluid buildup within the belly. We may see neurologic signs from the toxins that the liver is supposed to be filtering out and doesn't. And sometimes we'll see gastrointestinal signs. The bird just feels nauseous and pukey, or it just doesn't feel like eating because their liver function is tanking. There are many, 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 many causes of liver disease in birds. You could just about write a book chapter about it. Unfortunately, though, by the time that the bird is showing us signs, in many cases, there's already fibrosis or cirrhosis of the liver. And these are two different versions of basically scar tissue building up within the liver. The original cause is long since gone or has long since been replaced by all that scar tissue, and we will never know what started off in the first place. Unfortunately, that fibrosis, once it happens, it's irreversible. It's a scar. We can't bring back that functional liver tissue anymore. One of the ones we have the most control over is fatty liver disease or hepatic lipidosis. And this is a fatty buildup within the liver. The birds that are affected by this are most commonly on a seed diet. If you can correct the diet, the fatty changes tend to take care of themselves given some time. And of course, cancer is a very, unfortunately, common cause for a liver function to decline with age. In terms of protecting the liver, diet improvements, again, are one of the things we harp upon. If you are sensing a theme here, diet. Some certain supplements have been shown to have some effect with liver disease. Milk thistle in particular has been investigated, and it does seem to have some effect in protecting the liver from toxic change. Now, early studies didn't show a lot of effect, but they were using some pretty ridiculous toxin doses on these poor birds, and surprise, surprise, the supplement didn't help because they were hitting these livers with basically toxin doses that were far outside what an actual bird would really experience over the course of their life. Some, such as S-adenylmethionine, also known as SAMe, have a protective effect on immune function and repair from damage. And there are other supplements out there that have been suggested, but these are the two we tend to rely on the most. Other medical treatments really depend on the cause. For example, if you've got liver fibrosis, we have medications to stop you from developing more fibrosis and scar tissue. It may be a job for antibiotics. The Rowdy Bush diet we have a picture of there is their liver-specific diet. And it's formulated with a lot of the same principles that are used in formulating canine and feline diets for animals with liver disease. Basically a different protein profile that is a little bit more liver friendly and helps to preserve liver function. Reproductive problems are occasionally something we will bump into with age. Typically, this is more of a chicken problem than a bird problem. But if you, say, have breeding birds, you will notice that over time they are not as reproductively successful. The clutches will be farther between. They'll be smaller. They may lay a bunch of dud eggs, whereas in the past they were very successful breeders. With a lifetime of breeding, it takes its toll on the reproductive tract, and these are birds that may be more prone to egg binding or dystocia. Ovarian cysts have been reported in older birds, and in the worst cases, oviductal and ovarian cancers have been reported. In terms of prevention, environmental change can be very helpful if we provide them with the kind of environmental changes that do not tend to promote breeding. Basically, they are seasonal breeders. They breed in the spring and summertime. They tend to shut down those processes in the fall and winter. So trying to basically trick their brains into thinking it's fall and winter gives those reproductive structures a rest, if you will. And that tends to be protective against developing problems. Hormonal therapy such as Lupron can also be helpful. It's basically tricking the ovaries into giving up for the season. One thing that we have encountered in the past year, some of you may be familiar with deslorelin as a hormonal implant that's been used to treat reproductive disorders in birds. It works just like Lupron. There has been some clarification in the past year from the FDA as far as the official approval status. Basically, when deslorelin was approved for, well, semi-approved for use in the United States, it has what's called a conditional approval, where the only things we are actually legally allowed to use it for is specifically what is written on the label. It is not formally approved for use in the US for anything except ferret adrenal gland disease. And if we use it for other things, potentially we get in deep trouble with the FDA. Now, in other countries, it has been approved. They use it for reproductive problems in birds all the time. It's safe, it's effective. It's just that basically in the US, the FDA and the manufacturer need to get together and finalize the approval process. But right now, unfortunately, we've had to withdraw that option for bird clients because we have to stick to the letter of the law here. In the most extreme cases, we may talk about surgery to remove a tumor, remove an oviduct to prevent further egg laying. This is a pretty high risk intervention, and I consider it basically our last ditch effort if nothing else is working. There's a lot of important blood vessels in there. They tend to bleed very easily, and that can be a fatal bleed if things don't go our way. So we tend not to reach for that unless everything else has failed. The last of our medical concerns, of course, is the big C, cancer. Statistically, you are more likely to develop a tumor the longer you live. So you tend to see this in elder birds more so than younger birds. And it's been reported in basically any body system a bird has, ranging from the skin, the pancreas, the liver, you name it. The diagnosis, of course, it depends on the tumor. Sometimes it's flamingly obvious that there's a tumor on your bird's butt. Sometimes it's a blood work diagnosis. Sometimes it's an X-ray diagnosis. Unfortunately, right now, where we are with avian oncology is that well-tested options are few and far between. A lot of the information we have on cancer in birds is based on case reports or case series. Basically, hey guys, I saw this lorikeet. We diagnosed it with this. This is how we treated it. He did great. He did not do great. Here are the consequences and complications we saw, and this is how long we were able to keep him alive. Hey guys, I saw 2 African grays with this. We treated them this way. This guy did great. This guy did not. Woohoo. But there's really not much in terms of, all right, guys, we had 60 African gray parrots with leukemia. We treated half of them this way, half of them this way. This one was found to be superior. This one had X, Y, and Z problems. A lot of the doses we use, a lot of the treatments we use are based on what works in humans and dogs and cats. So, okay, we have this bird with lymphoma. This is what we would do if it was a cat. Let's try it. So still very much in its infancy, but in general, the most common things we use to approach it include surgery, chemotherapy, and radiation therapy to control these things. In some cases, it's palliative care. We keep the bird comfortable until the cancer, the tumor is unbearable. Now, a really cool thing that's been gaining some traction in the past few years, this is the Exotic Species Cancer Research Alliance. This is a collaborative grouping between Stanford University, a colleague of mine, Ashley Zender, and North Carolina State Veterinary School. Basically, they're building a tumor database of all the different tumors that affect our exotic friends. They started it with birds, but they've expanded it to rabbits and ferrets, etc. Basically, what they're looking for is for everybody, not just researchers, not just people at universities, but everybody. If you've got a case, if a doctor has a case of a bird with a tumor, they want you to go to that exotic tumor database and basically enter it in. And the goal is they want to collect information on how these things typically go, what treatments are commonly used, and how they fare. It's really helpful because a lot of us don't necessarily publish our cases. Either we're we're too swamped with other things that we don't have time to write up this cool bird for publication. Or, there's 8 birds that have already had lymphoma papers written. Do we really need number 9? So it's a way for everyday veterinarians to share what they've learned, share what they're seeing, and give us overall an idea of, what's the most common? How are we treating it? Is it really working? Is somebody finding a better way, but just hasn't talked about it yet? Now, they're still working on a lot of data analysis. They're still collecting cases. So a little too early to say what kind of conclusions were coming from this, but it's something pretty cool that, if you do have a bird that develops a tumor and you happen to pursue it treatment-wise or diagnostic-wise, if it's not one of our doctors, let them know. Say, hey, this tumor database is there. Would you mind sharing my bird in it? It's pretty easy. It's pretty user-friendly. And occasionally she even has student minions to enter cases for her. So if your vet doesn't have time to play with the database, they can just email over records and make a student minion do it for them. So the last part of considering the older parrot is basically what I call Polly's living will. What do we do when the time comes? With humans, we try to write these in advance so that our families are not left panicking and stranded when something terrible happens to us. We may want everything done to keep us alive for as long as possible. We may say, if I am on life support X amount of days and the prognosis does not look good, please unplug me. And it's important to have those discussions in advance so that our families aren't left floundering and panicking. It's important to have this with our parrot friends and even our dogs and cats as well. Have the discussions in advance. So when the crisis does happen, when the end does happen, we're not left in an emotional state where we can't make logical or rational decisions. So it's important to start it now. Even if your bird is still relatively young or even middle-aged, now's the time to start thinking about it. Have the family involved with your discussion. Anybody that interacts with your bird or helps care for the bird should be involved. Bring the veterinarian into the discussion. And the things you want to consider are, how far do I really want to go with this bird? Can I do all the things? Can I only do some of the things? At what point do we stop? What are our benchmarks for when is it time to consider euthanasia for my parrot? And there's no right or wrong answers with this. Everyone has a different benchmark at which they say this is enough. For some birds and some families, it's literally, when they're starting to have problems, we're going to call it then. For some, it's, when he's not playing with his toys anymore, but he's still eating well. Some will literally wait until the bird is basically on its back. Can we really do this? I can suggest all the things in the world to do for you, including supplements, medications, physical therapy, all that. But ultimately, if your bird tries to destroy you every time you medicate it, it's not going to work. Or if you have crazy work schedules and it's medicine that needs to be 3 times a day, if you can't keep up with that, is it really worth hassling Polly with it? Even us veterinarians have to grapple with that. If one of my cats became diabetic, this would be a major problem because I work weird hours. I may not be home for my cat's insulin dose on time. And my husband does not like needles. He's not going to poke the cat for me. So it's this consideration even we have to have. Ultimately, we have to decide, when is it time for euthanasia? And it's a hard topic to have. It's a hard topic. It's a terrible topic to discuss, but it's an important one. In addition to when, how do we do it? Many bird owners will bring their bird to the veterinarian and have it done there. Decisions involve, do I want to be present for this? Do I want to stay with my bird to the end? Do I just stay while they're sedating? Do I say my goodbyes at home? Some people prefer the euthanasia to be done at home where the bird is most comfortable. And not many of the home euthanasia services are comfortable working with the bird. So it's important to make those phone calls in advance. For example, the Lap of Love organization is a veterinary organization that focuses on home euthanasias and hospice care. If there's a local one that's willing to see your bird and work with them at home, great. But they may say, dude, I'm just not comfortable working with the bird. You're going to have to go to your veterinarian. But it's important to figure that out in advance so that when your parrot's in crisis, you're not calling Lap of Love only to find that, oh man, they can't help me. Another important thing to consider is that with as long as birds live, those elderly years may happen without you. I just turned 42. If I were to get a baby Amazon right now, I might be 90 plus when that bird is just starting to reach its senior years. I may not be able to deal with my bird at that point. And many people make the mistake of assuming that, hey, when I become incapacitated, when I pass away, yeah, my family will take care of the bird, no problem. Well, the bird may hate the rest of your family. The rest of the family may not be comfortable with the bird. They may not be able to take on the financial burden of taking good care of a parrot. It may be that none of the family wants to take over the bird, and then we're left with a poor parrot that needs a place to go, as Vicky and the adoption crew can tell you. So it's important to think about, where is my bird going to go? Who's going to take care of them? And have those discussions now. Hey, best friend, if something happens to me, would you be willing and able to take on the care of my parrot? Little brother, will you do it? Daughter, will you do it? And if it turns out that a rescue situation might be the best, sometimes it's good to start talking to the rescue in advance. Say, foster parrots. Some people will make advanced arrangements with rescues like that, saying, okay, when the time comes and I'm incapacitated, I want to transfer the care of my bird to you guys because I trust you. And I will arrange, this donation to help care for their medical and food needs when they go. But again, these arrangements have to be made in advance because you can't just go into a home and say, hey, foster parents, here's my bird, toodles. It doesn't quite work that way. So when it comes to making the decisions about euthanasia, there's never, ever, ever really a wrong answer or a single correct answer. It is what is best for you, for your bird, and your family. And there's no two families that are going to have the same answer here. You're going to have people in your life, friends, coworkers, family members that are going to try to shame you because you're not doing enough for the bird. What do you mean you don't have him on this medication? You should be medicating him. What are you doing putting that much into a cockatiel? That's silly. Don't listen to them. It's a matter of what is good for you, good for your bird, and nothing else. If the relationship with your bird means that you can do everything, go for it. If your bird tolerates handling so little that medication is not going to fly, hey, that's how they are sometimes, and that's okay. I don't want you getting mauled trying to get meloxicam into your parrot. And it's okay to grieve. People will often joke about you. Oh my gosh, look at you. You're crying over a budgie. How silly. Yeah, they can jump off a bridge. That budgie is just as much your friend and your companion as a sibling or a best human friend. Grieve. It's okay. Everyone grieves a little bit differently. Some of us just carry on with life and cry in quiet. Some of us are incapacitated for days or weeks, and that's okay. It is okay. Take your time. Enjoy your grief process. Well, not enjoy, but go through your grief process. It's okay. There are plenty of grief counseling services out there that do actually accommodate pet owners. And oh boy, well, unfortunately, the font is a terrible color on my screen. I hope it looks better for you guys, but I've included some resources for various pet loss hotlines. I just checked up on these on Sunday and they're still up and running, but there are websites with information. They've got online chats. With the pandemic, they do Zoom chats now and FaceTime chats with you. There's phone hotlines you can call. At the bottom, there's even a Connecticut-based pet loss website where they have grief counselors that work out of. There's one in Manchester, there's one in South Windsor, there's Glastonbury, Hartford. They've got pet loss support groups. There are counselors you can see. There are people you can talk to over the phone. There are people out there to help you navigate this. And don't be afraid to call them. That's what they're there for. All right, who's been paying attention? Yeah, I wouldn't do that to you. So ultimately, in sum up, we can expect some changes with age. It's natural, it's normal, but it's important to be aware that it may not necessarily be age, it may be disease or other issues that we need to control. So watch your bird carefully. You know this bird very well. You know what's normal, you know what's not normal. Involve your veterinarian in the assessment and the decision-making process. Sometimes we can spot things that aren't as obvious to you guys. We only see them twice a year, so sometimes we pick up on changes that are subtle and difficult to spot at home. Prevention, 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 prevention. The better care we can take of them while they're young, it tends to reflect in a healthier bird in the future. And even making those changes while they're seniors can help to promote a healthy life through their senior years. And as I harp on in this talk, as I harp on in exam rooms, diet is a very key important of that, or very key part. Yeah. We do have plenty of treatment options to consider for our bird friends. Even if it is normal aging change, we have ways to help you compensate for that. And while the future can be scary, don't be afraid of it. Approach it armed with knowledge, armed with discussion and thoughtful consideration of what's good for you and your parrot and what we can offer. Come on. Ah, cute picture. All right, and that does it on my end. Let's see. Onwards to the chat.
Wow, fabulous. Whoops, there we go.
Okay.
Okay, wow, very comprehensive talk. So many things covered. As I mentioned, the talk is being recorded so people can go back and listen to it again. So we have some questions. One person asked a feather question. I have a feather question also, so I think I'll start with that.
So,
and I just want to remind everybody, keep yourselves muted until you ask a question, then you can unmute yourself. So one person asked, what's the cause of parrots producing different colored feathers? For example, yellow feathers on a blue wing.
okay.
And then I'm going to follow that up with, I'm going to show you Parrot. So he used to be totally dark gray, he's normal gray cockatiel. I don't know if he's mixed. And he has some health issues. He's also quite elderly. He's 25 this week. And you can see his back feathers have changed color. He has a yellow belly now, which used to be totally dark. And I was wondering if you have seen feather changes like that associated with age also. So the two feather questions.
Well, a lot goes into the color of a feather, and it's not just pigments, but it's also the microscopic structure of the feather. So sometimes damage to a feather can result in it looking different. If a feather follicle is damaged, for example, like the blue wing producing yellow feathers, sometimes it's maybe we traumatically lost a feather, ripped it out, pulled it out, and the damage to the follicle can sometimes affect the production of the blue pigments and the structures that lead to the perception of a blue feather. And the end result is a feather that randomly comes out yellow. A good, nice example of that is, say you've got a chronically feather picking African gray that finally you get it under control and they leave their feathers alone and everything over their belly comes back red like their tail from the damage to the follicles. Nutrition does play a role in feather color as well as liver function. The building blocks are important. If you're not taking in the right building blocks, eventually feathers start to look funny, dark colors, dull colors. And likewise, as liver function starts to fail, the liver isn't processing nutrients like it used to. So the nutrients just don't get to the feather follicle in their proper form, and the result is that feathers come in funny. In some cases, it seems like there's even some just age-related, almost pigment exhaustion at the feather level, where just like people get gray hair as they age, the feather follicles may not produce the pigments or may not form those feather structures correctly to where they look the same. And so you'll get interesting looking feathers as the bird ages, simply from almost, you can think of it like a follicle exhaustion. Okay.
I'm seeing in the chat, we have a couple of questions. What type of bird was in your last slide? Clearly an Amazon. I don't know if you know which kind.
Oh, goodness. I'm not sure either.
Okay. And Vicki wants to know, what do you think of Metacam as a medicine?
I think Metacam is a really good weapon in our arsenal. It's got a pretty decent safety margin in healthy birds. I will qualify that, healthy birds. It does seem to have a really decent safety margin. The fact that it comes in a liquid form is really friendly to birds. And the dosing range seems to be reasonably wide. Now, birds with pre-existing problems, of course, cannot process meloxicam. And namely, these are birds with kidney problems primarily, but also liver problems. Those are birds where we would use meloxicam with absolute caution or not at all. My own resident research project involved using meloxicam in quail. Previous projects had found that the dose of meloxicam that's effective in parrots was considerably, we're talking minimum 10 times higher than what you would use in a dog, which shocked people. So we used some even higher doses in these quail, doses that would have a dog or a cat hospitalized on diuresis, if not dialysis. The quail were fine. Their livers were fine. Their kidneys were fine. Their intestinal tracts were fine. The only problems we found were basically annoyed and inflamed muscles from repeated injections of meloxicam. So the safety margin seems to be really good. Now, that said, there are certain parrots that, or there have been reports in especially some of the old world vultures where this class of drugs is not very well tolerated at all. Now, thankfully, none of us have to worry about treating old world vultures, but it does highlight the fact that there are some species specific differences. One particular study done in budgies found that doses lower than what we're using in the quail study and the parrot study before that were causing some blood work changes, but no one's really been able to reproduce that either. So I personally am a big fan of it in the right cases. We've got other weapons to use if meloxicam is just not the right choice for that bird.
Can they stay on meloxicam long term?
They can. Those birds, I usually will check blood work at least once a year to make sure that they're tolerating it. And that if we see any kidney or liver changes, we may swap to something like gabapentin in its place. But gabapentin, it has pain control properties, but it doesn't really do a thing for the inflammation, which is where meloxicam comes in handy.
Yeah, Pepper's actually been on gabapentin for years for what appears to be some sort of a nerve issue. And he seems to be tolerating it well, fortunately.
Yeah, gabapentin thankfully has a pretty wide safety margin. The average human would have to chug half the bottle to hurt themselves, and they'd probably fall asleep before they did any harm. But doses like easily 3 times what we use in parrots for pain control are used for seizure control. And even that is a fairly middling dose of gabapentin. So the safety margin can't be beat.
Fantastic. All right. If anybody wants to unmute themselves and ask questions, or you can also post questions in the chat.
Hi, Kristin.
Hello.
Very, very fine presentation. I thank you for that. I'm curious about something. Now, birds are not mammals.
Nope.
And a lot of the foods that they're eating, do they build up in their systems the way it builds up in our systems, such as say like, my birds adore peanut butter. They have it 7 days a week, but my birds are also active. They walk around a lot. They move along the perches outside the cage. Does this help burn fuel in the bird? Stronger metabolism?
Yeah. Well, any other species, movement and exercise helps to burn calories. Now, exercise, as they say, you can't exercise off a bad diet. So, yeah, there are people out there that go to the gym and then eat terrible things. Yeah. Eventually, it does catch up with them. And then you get us middle-aged people where we try to eat healthy and we're still getting a little thick in the middle here. And you mentioned the word accumulation, and it's an interesting one specifically with the peanut butter. With peanuts, there is an acceptable amount of aflatoxin that is allowed in human foods and peanut butter. And this is a fungal toxin that is very commonly found in peanuts. Humans can tolerate considerably more of it than a bird, but birds can fall susceptible to fairly minute amounts of it compared to a human, and aflatoxin is known to accumulate in the liver tissue. So it's something maybe consider a small once-a-week treat with the peanut butter instead of daily, if at all.
I make sure they have unsalted pistachios. They have absolutely no peanuts in their mix. There's no seeds in their mix. They use Golden Delight and they use Supreme. So they do pretty good.
Yeah.
All unsalted pasta, unsalted vegetables, or orzos. My cockatoo has an interesting snack. He loves to share whipped cream with the dog sometimes. All natural whipped cream, of course.
Well, he's not lactose tolerant, unfortunately.
Yeah, but what do they love? I can't understand it. They love cheese and they love whipped cream. And I'm like, but you guys aren't supposed to have this stuff.
Have it, and yet they eat it anyway. My cat would steal broccoli off my plate, and that makes no sense. She's supposed to be a carnivore. Silly things.
Well, I thank you for this information, and this has been a large help tonight, and I'm sure everybody loves the presentation. Thank you.
Thanks, my pleasure.
Okay, we have a question from Kim. How are medications given to senior birds? Oral/injection question.
Often we will rely on oral because it's the easiest thing for people to do at home. Some have absolute comfort picking up their bird, holding them in their hand, holding them in a towel, and directly medicating them. For some, this does not work, and that's where we will rely on sneaking it in through treats. Most of our hospital parrots get their heart medications and their fatty acids on a NutriBerry because they are total butt heads that would either destroy us for picking them up twice a day or they just would not have it. So I'm all right with sneaking in on a treat as long as they'll eat the entire treat. I've had some folks mix it with their cook mix for the day. The cockatoo that used to live at my residency program would take her daily medications mixed in a spoonful of baby food, which you would hold up to her and she would happily slurp it out of the spoon. Ultimately, it's whatever gets it in the bird. There are rare people that are comfortable doing injections at home. I find that most bird owners are really skeeved out, understandably, by that idea, but there are some that are comfortable with it. Most go orally.
By the way, not showing for senior NutriBerries, but and correct me if I'm wrong, but I think I remember reading they also have the fish oil in them as well, and milk thistle. Pretty much kind of every supplement you mentioned, I believe, is in the NutriBerries. I can't speak to doses and stuff.
Yeah.
But they do have all those various supplements. That's how they're designed.
Yeah, they don't really specify in the packaging the amounts of the various supplements, which is my one annoyance with it because I don't know dosing. But on the other hand, it's proprietary information, and with supplements, they don't necessarily have to tell you that.
For what it's worth, our bird will not touch a senior NutriBerry.
Bummer.
So there must be a lot of the good stuff in it.
Probably. I would think with the ginger component that they might be tempted to snack on it because Lord knows bird loves spicy, but.
Yeah, she likes any other NutriBerry, but she will not touch the seniors.
Bummer. Let's see. I find that the senior ones though are a little bit, they're almost more like the pellet berry product because there's definitely more pellet in them. So that might be part of what throws them off.
Okay,
I should mention,
go ahead.
my birds, none of them like NutriBerry, and having a large flock, it's terrible that if nobody will try it and be adventurous, then nobody else will.
Yeah.
I've had a lot of luck with medicine using millet. And I'm talking about just a little itty bitty sprig so that they get it on there.
Yeah. And now, while, millet is generally something I suggest we use sparingly, I'm also a fan of what gets the job done. If it means we reach for the millet to get medicine in, God bless, Godspeed, is better than no medicine at all. So with your group, I'd almost wonder if it would be worthwhile to take like a micro zester and zest a glucosamine tablet into their pellets or something.
One of the other problems I have, and this isn't really a question, it's just so tough as they get old and you try and limit them, and they don't want to be limited at all.
No.
I mean, Belle, my Indian ringneck.
Oh,
her
yeah.
latest adventure was a tumor on her third eyelid.
Ooh.
Yeah, you went. One of the other vets at your place did surgery on her about a week ago. And she's got a ton of trouble. She doesn't fly because she doesn't have any tail feathers. Never had them since the day I got her, which was probably over 10 years ago. Tried to limit her, and she was just miserable. I'm finally giving in to her. You do what you want. Be happy. I'm sorry you fall off your cage on the floor, and that breaks my heart. And someday it's going to be a real problem.
Yeah.
But the opposite just is she is so miserable.
Yeah, it's a catch-22 because you want to do everything you can to protect them, but as they say, you can lead the horse to water, you cannot make them drink. You can do things for the bird, you cannot necessarily make them behave themselves. You can take the post-op neuter bunny and tell the owner to cage confine them, but if they're going to zoom around anyway, it is what it is.
Yeah, I caught her hanging on the top of her cage by her beak.
Oh.
And I mean, she was there for a while.
Yeah.
I couldn't believe she could scream and hang on at the same time, but she can.
Oh yeah, Larry does that all the time. He'll be hanging and screaming concurrently, and I have no idea how mechanically this works, but he does.
And I have one blind cockatiel that came to me as blind. And Amy was at the house one time, and she came up to me and she goes, "Why you got a mirror in a blind bird's cage?" But it's a toy. The bird came with it.
True.
He's happy. So stay with the mirror.
He's used to it and he may not see himself, but just knowing it's there might be all the
Mhm.
comfort he needs.
Yeah.
Okay, we have a question. Are there any risks with introducing senior nutri to relatively young birds, such as 5-year-old cockatiels, just to get them used to the taste for later on?
Yeah, a lot of the things that they include in there are supplements, but I wouldn't say there's necessarily any age where it's too young to introduce them, especially with things like glucosamine. I started glucosamine in my 30s, and theoretically, I shouldn't have to do that for another 20 years or so. There doesn't seem to be any age-related problems with introducing those, and likewise with things like the ginger and turmeric components. There's no reason not to use them in a younger bird. Um, Most of the studies that were done with milk thistle were when you're working with research birds, many of them do tend to be kind of middle-aged to younger birds just by the nature of the process, especially when you're using, I think they were using pigeons. I can pretty much guarantee none of those guys were senior pigeons. So from that standpoint, I wouldn't have any problem with it. Have they been specifically investigated in younger birds? No, but there does not seem to be any harm with it. So I'd say go for it.
Interestingly, recent studies in humans with milk thistle for liver disease have finally put that to rest, showing that it really doesn't help liver function in humans at all.
Huh.
So I'm curious whether or not it actually helps in birds or not. It's that much harder to investigate in birds, but it also doesn't cause any harm, so there's really no downside to it.
Yeah, the original study looked at, I think, pigeons, and they were treating them with a ridiculously high dose of aflatoxin that, of course, you're not going to see any response. You're kind of frying their livers. And it was a dose that there's no logical way a bird would encounter that in such high doses all at once in their natural environment. It's just, they'd have to like lick the fungus to do that to themselves. It just, there's a newer study that I just downloaded like a week or two ago, but haven't gotten around to reading it. The abstract suggested that maybe some benefit. It wasn't like striking, oh my gosh, this is a miracle drug kind of effect, but so not as negative a response as we saw with the original pigeon study.
Yeah, of course, they're so different between species. Also, I am also encouraged, by the way, that we do have a lot of cardiac drugs for birds now. I know because 2 of my birds were on them.
Yeah.
They do seem to work really well. So
I think a lot of it boils down to people actually going to the cardiologist now and realizing that, hey, this is an option for my bird. So these are drugs we've been using in dogs, cats, and horses for years. But now that people are going the mile to get the bird diagnosed, we're learning that, yep, we can use these in birds just like we do in everyone else. And hey, it works.
right. Now, do you have any other additional suggestions for, say, little birds with splayed legs? I know we have someone on here who's been adopting some splayed leg budgies, and great with the perches. I don't know if you covered everything or if you have anything additional to say about that.
Yeah, unfortunately, the most awesome thing would be if we could correct them, but unless you catch them like super, super young, like in the nest, still have cartilage skeleton, that's when we have our best effect with things like placing hobbles and doing modified nesting. But once the skeleton calcifies, those legs are what they are. So ultimately, designing their cage with mobility and safety in mind is the most key thing. Is just keeping them as comfortable as possible, padding, accessibility. I mean, our 2 guys certainly enjoyed very happy budgie lives. Obviously, they were able to get up on those shelves without too much trouble. So they're not necessarily, completely immobile. They just needed accommodations.
Do they tend to get arthritis earlier?
Well, hard to say with those guys because our 2 were basically not bearing weight on their legs at all, aside from when they were hanging on the side of the cage. I have met some African gray parrots that had toes bitten off by their parents while they were in the nest, and they basically walked on nubs. And those guys did seem later in life to develop some issues with arthritis. Ultimately, that owner, I think, gave the birds away to a rescue, and I lost follow up on those guys. But I mean, they were not the most mobile birds, and they were definitely their knees were not quite what they used to be, but nothing I wouldn't expect for a bird in that situation.
Okay, we have a question. My cockatiel doesn't like nutriberries. Are there any other healthy supplement foods you would recommend?
Oh, veggies, 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 and more veggies. Yeah, the nutriberry is a nice way of getting some of those supplements into the birds, but ultimately, of course, some birds don't like them. Vicky can attest to that. And that's where we start relying on other food items. As I mentioned, the brightly colored vegetables are a great source of vitamin A, which is wonderful for your skin health, your intestinal health, respiratory health. And they're also some of your dark leafy greens, which admittedly are not the most favorite things for birds, but they're great sources of vitamin D and calcium, as well as the B vitamins. There's not as necessarily an established dose for like what is the effective dose of ginger for a bird, what is the effective dose of glucosamine for a bird. So I suppose worst case scenario, you could grate a little tablet into their food. Maybe they'll eat some with their pellets, maybe on a strawberry. Birds do tend to like the spicy food, so having a little nub of ginger here and there could be interesting to them. But ultimately, yeah, I think, just a good healthy diet, especially focused on the veggies more so than the fruit, is probably the best thing.
Interesting about ginger. In humans, ginger, if you have excessive ginger, it can cause bleeding problems, excessive bleeding. I was wondering if that's something that's ever seen in birds.
Not that I know of, but I can't say people are doing much more than like the teeniest nibble of ginger, if anything at all. So it may be something we just haven't recognized yet.
Yeah, I guess maybe somebody took a whole clump of ginger and attached into the cage. That could be an issue.
That could be something, or maybe somebody that plowed through an entire bag of ginger candies all at once. And
Right. Okay, we have some more questions. Someone had asked earlier about, what age is a teal a senior, and I'd said basically above 15, above 20 is really kind of elderly and geriatric. When you look back at these old books, back before we had good diets, they were saying a teal a senior at 10 and a budgie at like 3 or something. But I think we've moved the needle quite a bit to the right with all the birds with healthier diets.
Yeah. I think the one exceptions are going to be the extreme color variants, like what albino cockatiel makes it past their 10th birthday. But we've bred them for looks and not necessarily for health. And likewise with the pure white budgies and some of the weirder color variant birds.
Right, unfortunately.
Mm-hmm.
Okay. Do we have any more questions? Oh, Susan.
Oh, you're still on mute.
You're on mute, Susan.
Here I am. Okay, I'm off mute. Okay, I just wanted to ask you to say something about how garlic and onions affect the nucleus of the blood cells in citizen birds
And this
birds in general.
Yep, and this is even technically true for mammals, including humans. Garlic and onion can be toxic in the right amounts. If you're a human, you're probably eating multiple cloves of garlic all at once, which A, I question your taste in food at that point, and B, who can really eat that amount in one sitting? With birds, though, it doesn't take much more than a couple nibbles. So, and what she's referring to is you can see basically hemolysis, or a rupture and breakdown of the red blood cell from eating onions and garlic. I tend to avoid those like the plague in birds, and that includes things like pasta sauces with heavy, straight tomato would be one thing, but your grandma's favorite pasta sauce, yeah, bird does not need to be eating Nona's pasta sauce.
No.
Things like salsas are a consideration, guacamole, obviously for not only the onion, but also the avocado, scary. But those definitely should be avoided. I know in some human supplements, and people have used garlic as a flea preventative in dogs. Dogs have at least a little higher tolerance for it, but certainly you will see onion and garlic toxicosis in the emergency room if you work with dogs and cats long enough. But
Yeah, I
the market
imagine
is thin.
that
That's
would be
interesting because
something. I had a double yellow headed Amazon that would kill for garlic. Anytime I'd be chopping up garlic, she'd be trying to get into it.
No.
And I had done some research for some articles and learned about this.
Yeah, it's interesting because onion and garlic both make me quite ill too.
Oh, no.
Something I developed later on in life. And I wonder if it's a similar mechanism.
Yeah.
That happens with other people too, but yeah. Okay, so we have a question about use of midazolam for monitoring, giving a little drop of midazolam to a bird when they have an X-ray. Are there any risks associated with that for either younger or older birds? And do birds need monitoring for that?
Well, part of it is dependent on the exact situation and what kind of level of sedation you're aiming for. Midazolam's safety margin tends to be pretty good, and it's one of my favorites to use for sedating birds, both young and old, and I trust it even with some of the most debilitated birds out there. Sometimes we're able to get things like blood draws and physical exams and even some x-rays done with just midazolam, maybe paired with another drug. The main risks would be, heavy dosing, or if there's impaired drug metabolism, they may not sleep it off quite as easily. We do have reversal agents that can help counteract that. If anything, there are other sedatives I would be more terrified of than midazolam, but they're not ones that, at least in my experience, get commonly used with birds. My inclination would be if a bird has complications from midazolam, it's probably not the midazolam talking, but what's going on with the bird under that.
Yeah, one of my cocktails had a little bit back in December for an X-ray, and they just put a little drop on the nose, and he didn't need any reversal. He just, he's a little dopey for about an hour, but you don't normally need to reverse it unless there's an issue, right? Just give a little bit.
Yeah, if it's a bird that gives me the heebie-jeebies about sedating them in general, I will reverse them as soon as I'm done, just to make myself feel better. But in many cases, it's not such powerful sedation. We just need them to not care what we're doing, that I'll just let them sleep it off. It doesn't take that much longer.
Yeah, it's kind of like getting Valium for an MRI. That's the way I kind of feel.
Yeah.
Okay, let's see. We have another question. We get a lot of calls from folks whose parrots passed away at what they thought was a young age. I think the websites seem to overstate the parrot's lifespan. What do you think? For example, a conure who passes at 25, but owner says website says that species would live until 40 years.
And some of those websites tend to cite more the extremes, like the record-setting conure lived to 40, therefore they can get to 40. It's like expecting, you're going to live to 110 just because there's an old lady in France that got to 110.
Right.
Sometimes I find owners sometimes either over or underestimate their parrot's age. They joke about it in dogs and cats, where as soon as they go to the emergency room with a serious illness, they magically become 5 years older than they really are because, he's old, doc. So sometimes people, when their bird starts to develop problems, they think in their mind that they're older than they really are. Or if something tragic happens, they subtract some years because, oh God, how could this happen to such a young bird? So some of it may just be not necessarily the website's fault, but maybe the owner is misremembering the age. They age so well that the hand-me-downs from family members, sometimes they have no idea how old that bird is. It's either like 3 decades older than they thought it was, or it's only a couple years old. Lord knows I've met plenty that have the old open leg bands from importing, and the people get it and say, oh yeah, he's only 5. Like, nope. That bird is minimum 30. Thank you very much.
Right.
The age. Oh, that is the question of the hour, Vicki. So sometimes we get lucky and there's a leg band with a year printed on it. And that makes me very happy because we can at least narrow it down to the year. With the older leg bands, they're the kind of rolled, rounded ones with a gap in them. Those are called the open leg bands. Those were used in birds that were imported into the United States. Now, this practice stopped in the late 80s, early 90s when the CITES regulations went into effect and it became illegal to import wild birds without specific permits and purposes. So the only time you see those style of bands anymore is one of those older birds that came in before the import ban. So that is a bird, you cannot predict its exact age, but it's bare minimum early 30s or older. It could be 60, it could be 31. You don't necessarily know. without those, it's really hard to tell. I mean, you can tell the baby budgie by the stripes on its head, but once those stripes recede, who knows? The glory of birds, they age really well.
Yeah, I've kind of had that conversation with my vet too, and she's saying sometimes if they're really old and you look at their legs, its skin starts to get thin, like with elderly humans, and the skin, it starts looking like old bird legs.
Yeah.
But again, that's sort of extremes. Like the bird's old, but if they're anywhere from like 1 to whatever the type of species is, 20 or 30 or 40, you can't tell within that range.
Sometimes just the way they carry themselves, you just know looking at them that they've seen many years, and what all you can do is guess.
What those eyes have seen.
Indeed.
Okay, any more questions? Okay, well, if not, I want to thank you so much, Kristin. You always give the best talks. There's always so much information. And if I get any questions, I'll also I'll pass them on to you. And so the talk is recorded, so you can go back and read that. But I want to thank you so much for talking to us tonight. This was a great talk as always. I'm actually going to turn off the recording.
Absolutely. Thank you for inviting me. It's always a pleasure, and it forces